Good afternoon, everyone. Welcome to the September edition of our eJournal presentation. My name is Dr. Ersoy. I'm the chair of ASC eJournal committee, and I'm happy to welcome you all to our discussion today. The actual presenter would be Dr. Nawgiri, which is a member of ASC eJournal committee, and she has invited the authors as her guests. We are very pleased when the authors actually accept our invitation and join our discussion. That gives a different level of interactive discussion and learning mode for everybody. I am very soon going to let you guys get to the meat of the presentation. I just wanted to tell you that we normally leave about 5 to 10 minutes, maybe more, maybe less, at the end of the presentation for question and answer. In the spirit of an interactive presentation, I would invite and encourage the audience to actually have their questions and comments and suggestions in the question box. I will monitor that, and then at the end, we will go through the questions and we will get the answers as they come. So with that, I will ask Dr. Nawgiri to join us in the presenter mode and invite her guest authors. Thank you very much, and we are all ear to hear.
Thanks. Thank you, Dr. Ersoy. So my name is Ranjana Nawgiri, and good afternoon, everybody, or good morning, depending on which side of the coast you are in. I am a cytopathologist, and I'm the director of the cytology division at the University of Texas Medical Branch in Galveston. The journal topic that is being discussed or presented today is a comparison of low-cost phantoms for ultrasound-guided fine needle aspiration biopsy training. And I was really really delighted when both the senior and the first authors, said that they would be happy to present this. But before that, just a little bit, as physicians, we are often called on by other colleagues to do FNAs at the bedside or in clinics. And to this end, our training programs incorporate teaching our residents and fellows this important skill. The inclusion of using ultrasound guidance has expanded in practice and requires cytopathologists to be familiar with this technique and training our trainees. Using phantoms and training models help in developing a good hand-eye coordination, which is key to improving the accuracy of the needle placement during the FNA. And like I said, I'm really delighted that both the first author, Dr. Xiaofeng Zhao, who is now an assistant professor at the Cooper Medical School of the Rowan University in New Jersey, and the senior author, Dr. Dianna, currently an assistant attending in the Department of Pathology at the Memorial Sloan Kettering Cancer Center, agreed to present their paper, and they're here to do that. So welcome, and I'm going to hand it over to them.
All right, well, thank you for the warm welcome. It's a simple study, but I actually think it's one of the most fun studies that I've been involved in. Ultrasound phantoms are something I've been thinking about for a long time, ever since I was a fellow. I personally went to a residency and fellowship training program that actually did a lot of FNAs, both palpable and ultrasound guided. And I was always trying to think of a better way to train both residents and fellows, as well as other attendings and general community practitioners. This especially kind of links into some of my global cancer work, particularly in East Africa, where fine needle aspiration is the primary mode of diagnosis. So that's kind of what really encouraged me and motivated me to do this project, just because, as we know, a lot of the commercial phantoms are very, very expensive and not necessarily accessible to a lot of places. And also, it's hard to buy multiple versions of them as well. So just as a quick overview of today's talk, we'll have just kind of briefly go over the different commercial and homemade phantoms out there. By no means is this comprehensive. There's a vast literature out there, as well as many, many different products. And I'm not necessarily endorsing any of them. We'll go over why hands-on practice is really important for learning a technical skill. We'll actually start to understand what are the key characteristics when we do evaluate an ultrasound phantom. What do you want to look for? And then also some of the benefits and limitations of each homemade phantom type. So ultrasound phantoms are an excellent way to introduce ultrasound-guided FNA technique. This is particularly important when you have someone who's completely brand new to doing biopsies, whether they're a trainee or even someone who's been a practicing pathologist for a long time, or radiologist, surgeon, etc. This is a matter of safety. You want to teach basic technique before you introduce a trainee to a patient. It also increases the skill level of the trainee and confidence of the trainee. So it's really great. You can customize it to have cystic lesions, you simulate necrosis, have more solid lesions, things that are hyperechoic, hypoechoic, etc. Phantoms, can be customized, as I mentioned, and a lot of the literature out there is actually does not address ultrasound-guided FNA in particular. A lot of the literature on ultrasound phantoms, particularly on vascular access training. So the emergency medicine and surgery literature is actually really rich with ultrasound phantom recipes. But I think the needs are a little bit different just because ultrasound-guided FNAs are not the same as learning how to access vessels. And then there's actually also phantoms for arthroscopic procedures. So, and phantoms, as we know, for other things like learning how to intubate, phantoms for everything, any skill set that you might want to learn in the medical field. So I just want to point out that training is essential for FNA, palpable and ultrasound guided. I think the barrier to entry to fine needle aspirations is really low. And so people think that you can do it very easily, very well. The reality, it's almost like driving a car. I think a lot of people can drive a car, but it actually takes a lot of polish and experience and feedback to drive a car really well. For example, to be able to drift, or to compete in some sort of race. So the barrier to entry is really low, so people assume that anyone can do it really well. The reality is, without training, the reality is that most people can do this well, but it requires a lot of feedback. So this is a slightly older paper from Dr. Britt-Marie Young, and it looks at the difference between people who are formally trained versus people without formal training. So they looked at 102 breast masses that were breast carcinoma, and they found that the sensitivity of people who were formally trained was much higher than the people without formal training. So 98% versus 75%. And almost all of this was due to sampling error, not interpretive error. One thing to know is that in this paper, how they defined formal training was someone who had been received supervision, had performed 150 FNAs under supervision with feedback, and had performed 100 FNAs in the past year. So that's a lot, and probably more than most kind of residency or fellowship programs actually offer. But I think it's actually unclear at this point what the minimum number is, and that would actually be an interesting paper to do. What's the minimum number generally for people to reach competency? And I just want to also point out how ultrasound has really changed how we perform FNAs. Palpation, I think, is great, but I think a lot of these lesions that we're seeing are getting smaller and smaller, or especially in thyroid, are not necessarily palpable. So this is just a meta-analysis. I just want to point out this pooled data set where for palpation-guided FNAs of the thyroid, the sensitivity was 76% and the specificity was 77%. while for ultrasound-guided FNA of the thyroid, the pooled sensitivity was 90% and specificity was 80%. And this is just all comers. So we actually don't know the level of training of these people who kind of were in these studies. Some of these studies are quite old when ultrasound-guided FNAs were not as common. So I might imagine that, you know, if you look at more recent studies, you say 2010 and after, the statistics actually might be better. And there's actually a lot of science around teaching technical skills. You know, there's a whole field of medical education. I'm not going to go into details, but there's essentially well-described factors that have been identified that influence the learning of motor skills. And so you could almost see that as you kind of go down this list, the top of the list is observational learning. That's actually important as an introduction, but probably the lowest quality of learning. And then kind of as you go down, it's important to have the person be focused. You know, obviously, you know, if you're distracted, you're not going to learn. But having feedback, immediate feedback, is always really important. And I do have to say that in our practice at MSK, so some of the pathologists actually have gotten so good at reading head and neck ultrasounds that they actually might be better than some of the radiologists at our institution. And then having self-controlled practice, time to really focus and dedicate just small amounts every day or every few days so that you kind of gain that muscle memory. You're not going to learn a motor skill in just one setting. So really having this practice be able to occur frequently and with feedback. So as I mentioned before, there's a range of commercial phantoms out there. Some of them have reusable components, like this one from Sawbones. They have little reusable packets that you can insert in different areas of this kind of torso. The Blue Phantom, which is what we use at MSK, you know, it's and what we used in the study as our baseline comparator. This is from Clear Ballistics or Humicic. This is actually, as you can see, for vascular access, and it's opacified so that it has kind of this fleshy color. This one's kind of interesting, where apparently if you heat it, it can reseal track marks. I personally haven't tried it, but I think that would actually kind of extend the durability and lifetime of these of some of these phantoms. And then there's this one as well from Medline, which looks like a breast. So obviously it's supposed to simulate breast FNAs, but I know kind of across the board nationally, breast FNAs are getting less and less frequent. But this might be important in like a low resource setting where breast FNAs are really the primary mode of diagnosis for breast masses. And then one thing to note, I think Xiaofeng will get into this, is the prices of these kind of range quite drastically. I know at the time of the study, this was about $600, the Blue Phantom, which is on the upper right. And then the Sawbones, I think, is right now currently like $1,200. These prices are going to change drastically, but what I've noticed is that over the past few years, it's really gone up. I know when I was a resident, the Blue Phantom was something like $250. And so they're not getting cheaper, which I wish they would. So this is where the homemade phantom comes in. There's been a lot of papers out there really just describing just a single recipe. There's only one paper looking primarily at phantoms for vascular access that actually compares homemade phantoms. But by far and large, in the pathology and also other literature, you get just these one-off recipes. You know, there's no kind of titration of concentrations of different materials like gelatin or silicone, really looking at the best concentration. So this is kind of where, when I started looking at the literature and trying out a lot of these recipes, I was like, this is so variable. Some of them didn't even work, even though, you know, the paper said this is great, could be done in a low resource setting. It's like shelf stable, and I found that that wasn't actually necessarily true. But just going over some of the components that homemade phantoms can be made of. People have described gelatin, silicone, ballistics gel, agar, which I actually don't recommend because it just shatters, agarose, Premazorb, chicken or turkey breast, canned cooked pork, tofu, and I'm sure there's actually many others out there. People have also suggested using plastic bottles to simulate the trachea, and they get really, really creative, and it's actually really fun and exciting to read some of these papers. And just kind of reiterating why it's so important to use some of these phantoms for training. I think they're really great for workshops. Homemade phantoms in particular are great for workshops at like conferences, or say, we did a workshop in Tanzania, and this is some work that I did with my mentor, Ron Balasanian, when I was at UCSF. And what we did was that we did a 2-day workshop where we trained both radiologists and pathologists at Muhimbili University of Health and Allied Sciences in Dar es Salaam, Tanzania. And we used chicken breast and primarily chicken breast and olives to train people. And here you can see a radiology resident, learning how to scan for masses and then do a FNA. And what this paper found is basically based on the pre and post test, there was statistically significant improvement in almost every technical skill that we evaluated. So positioning of hands, positioning of transducer, identifying the lesion on the screen, repositioning the needle, performing adequate excursions, visualizing the lesion in maximum dimension, measuring it in 3 dimensions, visualizing the needle tip, and then targeting in both the parallel and perpendicular method. So with just one workshop, there was significant improvement. Of course, I think the plan is to see if there is sustained improvement over time. And that would be the ideal, but very hard to measure. All right, so I'll just hand off the rest of the talk to Xiaofeng.
Thank you so much, Diana. I'm going to take over from here and share more information of our study. So when you think about getting a phantom for training your trainees for ultrasound-guided FNA, I think the most convenient way is to get a commercial phantom, which is available, ready to use, and with documented, good performance. This is one of the examples that we use at our training program at MSK. It is called the Blue Phantom Soft Tissue Biopsy Ultrasound Training Block. And this is also the one that we used in our study, like Diana mentioned before. So there are several very nice features about this phantom. First of all, the material is very elastic, sort of simulating the human tissue. And also the convex surface also simulates the human habitus. Secondly, there are several masses or target lesions that you can practice your ultrasound-guided FNA technique. To be exact, there are 16 of them embedded randomly into the block. So you can learn how to place the transducer, how to insert your needle into the target. Lastly, this material used for this phantom is very, very durable. It never degrades, and it says to have a self-healing, capacity. So it can take like thousands of needle punches, but nothing's perfect. There are several things that are not that nice about this phantom model. One of them is the price that we put here, and you also learned from Diana that this single piece will cost about $600. Just imagine if you have like multiple trainees working at the same time and you want to get one phantom model for each of the trainee, it will be very costly. So in this case, we are thinking, maybe we can customize our own phantoms at home using much cheaper materials. And you do have options. Next slide, please. So there are several materials that you can get easily from the supermarket or market for much cheaper prices. They are like from tofu shown here and canned cooked pork or even chicken breast. So you can get all of them for under $5. All you need to do to make them, to be used as a phantom is to insert, different target into them by making, small cuts or slits on the side, and then insert your targets. For given targets, you can be definitely creative. For smaller ones, you can use baked black beans. For larger ones, you can use pitted olives. So after inserting the target, oh, by the way, try not to disturb the surface because that's where you placed your ultrasound transducer. So after inserting the targets, you can wrap them up with plastic wrap to sort of keep them in shape. Next slide, please. So you can see here, these are the finished homemade phantoms from this material: chicken breast from tofu, canned cooked pork, and our commercial phantom. So some of you may think, you know, a piece of chicken breast does not look very professional in my lab or office. In that case, you have other options as well. And one of them is ballistic gel. Next slide, please. Ballistic gel is a very interesting material. It's actually generated to sort of study the effect of a bullet wound in human muscle. So this material is very similar to animal muscular tissue, not so much to skin or adipose tissue. So you can get the ballistic gel from certain particular suppliers, and you just need to cut them up and melt them down in an oven at a relatively low temperature. For detailed instructions, you're more than welcome to refer to our article, which is very easy to follow. So I have to mention that you do need an oven for to make this phantom model. So maybe not very possible or likely in your office. You can definitely do that in your kitchen. This material is definitely not hostile to the environment, and there's no special handling care to be concerned. After the ballistic gel is melted down, you can put in your targets. So for your target options, because this ballistic gel will last forever, for a long time at least. So you want to use something that does not decompose, right? As a target. For our phantom model, we used craft pom-poms. As I mentioned before, ballistic gel, you can get them from particular suppliers, but it's not something that you can get from the supermarket. So you have other options, which you can get from the supermarket. Next slide, please. Which is gelatin gel. So gelatin is not a stranger to phantom models. In the past, if you look at the literature, there are many papers documenting using gelatin gel to make for making phantom models. But as Dianna mentioned, there's a wide range of quote unquote optimal ratios, meaning gelatin water ratios in this literature. And in order to figure out which ratio or which recipe is the best for our purpose, which is ultrasound-guided FNA training or teaching, we first did a little test by making a range of gelatin water mixtures ranging from 1:1 to 1:16. And then we test on the firmness or the texture of the gelatin. We concluded that a gelatin to water ratio of 1:8 and 1:10 were the best. And we're going to use these two ratios in our later study. So I have to mention that when you are making the gelatin phantoms, you need boiling water. This is feasible in your office, right? You can use a water boiler or microwave to make a boiling water for your phantom. I also want to mention that in the literature, in addition to gelatin, they also used other components like additives, like cornstarch or psyllium fibers, etc. But for our phantom model, we only used gelatin, just gelatin. We wanted to keep it simple and easy to follow. So for the final gelatin phantom model, you need about 500 mils of boiling water and an appropriate amount of gelatin. On the right, these are the two gelatin models, phantom model that we used in our study. I'm going to call them gelatin 1:8 and gelatin 1:10. And probably you have noticed that they are of different colors. Yes, we did added a few drops of food coloring in it, which sort of serves two purposes here. One is to tell these two gelatin phantom models apart, right? One is 1:8, one is 1:10. The other purpose is to sort of increase the opacity of the gelatin model. So sort of increase the difficulty or you know, making it more challenging for the trainees to practice their techniques. Next slide, please. So after you know, resolve the gelatin in boiling water, when it's cooled down to sort of semi-solid status, you can try to insert your targets there. For larger ones, you can use pitted olives, and the smaller ones we used craft pom-poms here. Try to place them carefully into the gelatin, and do not, you know, place them together. Try not touching each other or touching the edges. These are the cross sections to show you that these targets were embedded at different depths into the gelatin phantom models, and they do look pretty. Next slide, please. So you can see that in addition to commercial phantoms, you have several options to make your own customized phantom models at home. But the question is that do these homemade phantom models work well for our purpose, which is ultrasound-guided FNA teaching? You know, which one would be the best that you should choose for your setting, and do they perform as well as the commercial phantoms? In order to answer these questions, we invited 9 cytopathologists and cytopathology fellows who were doing ultrasound FNA regularly, so who were also very proficient in this technique, to evaluate the phantom model that we generated. So they were asked to identify the target using the ultrasound machine and perform ultrasound-guided FNA on a target using a 1-inch 25-gauge needle attached to a 10 ml syringe. This is also the most frequently used needle that we use for on real patients. And then after, you know, performing the procedure, a survey was asked to be completed by these participants to give their feedback. Next slide, please. So the participants were asked to evaluate the overall haptic properties of these phantom models, which includes both, you know, by touching whether it's similar to human tissue, and as well as after you insert the needle in the phantom model, that's the resistance similar to the real experience on real patients. And also we evaluate the echogenic quality of these phantom models, which means that whether we can see the model and targets clearly on the ultrasound. And then the participants will give their overall impression on whether this phantom model is useful for teaching and practicing ultrasound-guided FNA. So the gold standard would be our real-life ultrasound FNA experience on real patients. And for analysis, we used, you know, the participants gave different scores for different phantoms, ranging from 1 to 5, with 1 being the lowest and 5 being the best, the highest score. And then for analysis, we used a median to determine each graded quality. Next slide, please. So this is just a picture showing Dianna and I testing the different phantom models. In these pictures, you can actually find all of the phantom models that we used in our study. So Dianna is testing the haptic property or quality for the gelatin phantom models there, and I was trying to use the ultrasound to find a target on a chicken breast and trying to insert my needle there. And on the screen, you probably can appreciate the pitted olives in the chicken breast, right? It can be seen very clearly. And just remember, it not just us, there were 9 cytopathologists or cytopathology fellows who were doing this survey. Next slide, please. So these pictures to show you the echogenic quality of different homemade phantom models from top to bottom and left to right. You can see the echogenic quality of ballistic gel, 1 to 8 gelatin, 1 to 2 gelatin, chicken breast, firm tofu, and canned cooked pork. And probably you can see that, you know, both the targets and the needle can be seen very clearly on the ballistic gel. the gelatin models and chicken breast, right? And from tofu, well, it's still decent, but for canned cooked pork, you barely can see anything. So it's not very good in terms of the ecogenic quality. Next slide, please. Well, there are artifacts that can be that can occur to obscure our targets. On the left, this is actually the ultrasound image taken on the commercial phantom that we used at MSK for training the fellows. There was supposed to be a target there, but you can see there were numerous needle tracks there, sort of completely obscuring the target. So you can see that even though the commercial phantom, the material is very durable, does not degrade, but over time, as the needle tracks accumulates, it sort of becomes much less useful for teaching ultrasound-guided FNA. And on the right is a blister gel with a lot of air bubbles. So for when you are making blister gel phantoms, please note that any significant modification will add air bubbles in your phantom model, and which will obscure the target a little bit. Here is just an exaggerated example with a lot of air bubbles that we generated on purpose, intentionally, to show this artifact, which the air bubbles can obscure the targets, making it less useful. There are a couple of limitations for our study, obviously. First of all, we cannot use the same target for all of the phantoms. For example, for ballistic gel, as I mentioned before, the material lasts long, so you do not want to use targets that are going bad very quickly, right? Like grapes or olives. You want to use something that will last longer. And secondly, apparently all the participants could see their phantoms where they are testing them, so they cannot be blinded while testing. So some participants may have strong opinions to some phantom models without even evaluating, the qualities. Lastly, we did not systematically evaluate the durability of different phantom models over time. We basically throw away our organic phantom models like chicken breast from tofu after 1 to 2 days. And for the gelatin phantom models, they can hold up to about two weeks, I think, but we did not study until which day the mold started to grow, etc. Next slide, please. So let's see what we got from the evaluation. The first is the total cost for each phantom. Like we mentioned before, the commercial phantoms cost about $600. I checked recently, it's going up to about $700 actually, probably because of the inflation. And for our customized homemade phantom models, they are much, much cheaper, as you can see here. The chicken breast, extra from tofu, and canned cooked pork, you can get each of them for under $5. For gelatin phantom models, you can make the models for around $10, and ballistic gel cost a little bit higher, about $30, but still very affordable. Next slide, please. And then how about the time it costs to generate these homemade phantom models? For chicken breast, extra from tofu, and canned cooked pork, it takes really short time. Like you can make phantom models really quickly using this material, less than 5 minutes. So if you need something really quick, you can choose this material. And of course, the cost is that the shelf life for these phantom models are also very short, about 1 to 2 days. For ballistic gel phantom models and gelatin phantom models, it takes longer to make them, about 3 to 4 hours. But you can see that the actual active time for making this model is only about 15 to 20 minutes. So most of the time you're just waiting for the gel to melt down or to be cooled down. So you can use this time to do other things instead of being wasted. And also gelatin, like we mentioned before, the gelatin phantoms will last about 1 week to have a good, property quality. If you want to stretch it, you can stretch to 2 weeks, I think, if you store them in the refrigerator. But again, we did not do the systematic study on the durability. Next slide, please. So here comes the key features or quality that we care about in ultrasound-guided FNA training. One of them is the haptic quality. By touching the phantom model and also inserting the needle in them. To our happy surprise, the gelatin phantoms are performing very well, actually superior even to the commercial phantoms. They are rated very high, the highest in the haptic quality. Ballistic gel also performed very well, similar to commercial phantoms. But you can see that the canned cooked pork had a very poor haptic quality, so probably it's not very suitable for our ultrasound-guided FNA training. For echogenic quality, again, gelatin phantoms were rated the highest, superior to commercial phantoms, followed by ballistic gel, chicken breast, and extra from tofu. Again, canned cooked pork, not very good. They were rated very low. Next slide, please. So hopefully you won't be surprised by this result now because of the good haptic quality and echogenic quality. The gelatin 1 to 8 was rated the highest. It was picked as the favorite phantom model by the participants of this study. And it is considered to be the best in teaching and overall impression. The gelatin 1 to 10 is also very good, similar to with comparable performance as the commercial phantoms. Actually, the canned cooked pork is not very good, may not be suitable for our purpose, which is the ultrasound-guided FNA. And chicken breast and extra from tofu also had decent teaching usefulness and overall impression. Next slide, please. So in conclusion, if you have like several hours to prepare your phantom models, gelatin phantoms are an excellent alternative to commercial phantoms. But if you're looking for a long shelf life and reusability, then the ballistic gel may be your best option. And imagine if you are preparing for a workshop and the phantoms are needed for a short time and should be made only minutes ahead of time, then chicken breast and from tofu are inexpensive options compared to commercial phantoms. Finally, the canned cooked pork is not recommended for ultrasound-guided FNA practice. To summarize, again, ultrasound, we all know that ultrasound phantoms are excellent tools for teaching trainees, and training and practicing on these phantom models are really important to gain experience before you have your first real patient visit. And the commercial ultrasound phantoms are very durable and shelf stable, but they are expensive. And also over time, you will have accumulation of needle track marks. This will limit the usefulness of phantom as a training tool because it really obscures the targets. Next slide, please. So as an alternative, there are numerous homemade models that have been previously described in the literature. However, there's a remarkable variation in their protocols or recipes, and some of them, or actually many of them, were not optimized for ultrasound-guided FNA practice. However, our study does provide recipes and very simple recipes which are easy to follow for several homemade models, which are definitely inexpensive, and they are simple to make and fast to create. And these can be used as an excellent alternative to commercial phantom. We also provided the characteristics of these homemade phantoms. That's basically what we have from this study, and thank you very much for your attention, and hopefully you have found your favorite phantom from our talk or study. Thank you very much, and Dianna and I we'll be very happy to take any questions.
Thank you very much. This was very interesting. And I know as a cytopathologist for a long time, even before the USFNA come to life for pathologists, we have tried many different things, as you mentioned, and sometimes as nondescript as oranges and apples. So I have done that with my trainees, with my own training, but these are much more sophisticated, even the homemade models that you just mentioned. So I think it's a good way of trying to do it with obviously less cost, because 600 per phantom or 700 now is a big chunk of change. So, and if you have trainees that come and go in a big numbers, that would add up pretty much. So I do not have any questions that came to question box. That actually is not a bad thing. It means that you guys explained it very well. And I know last night in the Twitter chat, there was a lot of back and forth as well. So hopefully it has been looked at and thought about and heard. So there's really, it's really great. And I think it's a very practical view of something that we all have to, either as trainer or trainee, to kind of deal with. So and you made it very scientifically sound. You kind of compared, you kind of compare and contrast as far as the durability, the things that would be important in decision-making process. So anything else from anybody? Ranjana, Dr. Nawgiri, do you have anything else that you would like to add or say or anything?
I just have, I know this was mentioned, but how exactly do you, make the gelatin opaque? Is there, you did mention that you added, was it cornstarch?
Yeah, cornstarch was used in the literature for phantom models, but we did not use cornstarch in our study. It's simply just gelatin water. Basically, you pour boiling water into the gelatin and it's mixed. And you are welcome to add some food coloring to increase the opacity if you'd like.
Got it. Thank you. I thought this was really, really good little presentation and a great publication as well. Thank you so much.
Thank you.
The cornstarch really is for echogenicity. I think it's supposed to essentially make it simulate muscle a little bit more kind of. I've tried it before. I don't actually think it adds to the training experience. And also in a pinch, it can actually be surprisingly hard to find cornstarch in some places. Maybe not kind of on the Upper East Side where I am, but I found it a little bit challenging to find in last minute in some places. So that's why I think you can use cornstarch. We included in our paper as one of the recipes that has been tried, and I personally tried it, but I actually think it was minimal added value.
Very good, very good. So if anybody is okay with our presentation, anybody meaning the ones that we are here and also the audience who are listening to us, we can actually give back some time to everybody since I don't have any questions. Just want to add to it that if anybody came with a question or they thought of something that they wanted to run by the authors of this study, you're more than welcome to send us at ASC an email. We can forward it to the authors, and also you can either directly, probably, if you guys have provided your contact information, I'm sure it's on the on our publication as well. So you can reach out and have your questions, comments, your suggestions, looked at, and get your answers, I guess. I think if everybody's okay here, we can kind of say goodbye. Once again, I want to thank you very much for your time. It is really wonderful when the authors actually accept our invitation to come in and put as much as you guys put into presenting it to us, not only the work that you did in preparing the article, but also to presenting it to us. That's always a big plus for us, and I'm sure for the audience as well. Very good.
Absolutely. Thank you very much.
Have a wonderful day, and hope to see you guys all at ASC, I guess, in November. Very good. Thank you. Bye.
Bye-bye.
Bye, thank you.
Thank you.